Hi, this is Dr. DeSapri, founding physician of Bone and Body Women's Health. I wanted to talk about how we treat osteoporosis because I think for a lot of women it's a mystery. The most important thing to understand is if we're talking about osteoporosis treatments, we're talking to reduce your fracture risk. We're not just looking at the T-score. We know osteoporosis is more than just a number on a test. We're thinking about fracture risk reduction. And when we think about that, we want to be looking at you as an individual, your age, your prior history of fractures, your family history, your medical conditions, and your T and your Z score on your bone mineral densities and what those historically look like as well. So for instance, if you're a woman who is 60 and you have a T-score of -3 or lower, that is actually a high risk category. We know that the lower the T-score, the less bone that is there, the more fragile bone, the thinner the cortices and the microarchitecture for the bone have been deteriorated. So that puts you at an increased risk for fracture. So when we think about using things like oral bisphosphonates like alendronate or Fosamax or any of those medications, we know over 3 to 5 years the bone mineral density improvements will be around 3 to 5%. So that won't change the bone mineral density or the fracture risk as much as when we think about using things like bone building medications. So medicines that actually build or stimulate the osteoblasts, those medicines that might inhibit the osteoclast or the bone resorbing cells. So really important when we think about understanding why and how we recommend treatments, we look at the overall fracture risk, of course, patient preference, of course, past medical history. But when we're trying to affect a certain goal, like reduce your fracture risk, we really have to match what is the bone mineral density at each one of the sites with what is the treatment goal in terms of overall fracture risk reduction that we're looking for each decade of life. I hope to see you soon.